so-called HIP, Health Insurance Personalized. This is consumer's doctor on the behalf of foremost organization. I've been talking quite a bit on health insurance, personalized health insurance, folks. Let's look at how this health insurance industry started and how it took off. Originally in early 1900, people used to, pay cash to go to see a doctor, pay cash for everything, even for the hospital stay. But the hospital costs were so high, and it has especially became difficult to pay the bills for the doctors and hospitals. In early 1920s, when the depression is about, when depression, this is how it started, in a depression era where they had to come up with a solution how to cover the healthcare costs. So the Baylor Hospital in 1929, I think, year 1929, came up with they looked at their hospital bed costs, and they figured out a way to come up with it, because most of the people who were coming to the hospital who were not able to pay the bills, or their census were going down. They came up with a brilliant idea of getting a coverage for the hospitals. So that's how Blue Cross, original Blue Cross, started by Baylor in 1929, early 1930. They said it started as a small, 3,000 membership with a regular payment on a monthly basis for them to cover the hospital costs. You'll believe it or not, originally when they started this health insurance, they were paying 50 cents, just 50 cents on a monthly basis to get the coverage just in case if they got sick. And the hospitals basically, so the Blue Cross, the membership, what it started with, the 3,000 members, it grew up to the other hospitals in the local area. 3-4 other hospitals started participating. Ultimately, in Sacramento in 1935, they started the same concept, with covering the hospital cost through an insurance policy. So they were paying on a monthly basis to cover themselves for the hospital stay. And that grew to 20 other hospitals. And that's how the Blue Cross was able to come up with a monthly premium to cover the hospital stays. So they don't have to put the money from their pocket. That's how it. Then they were looking in the depression area. Then in lumber, especially in Washington state, they came with the same idea to pay the bills for the doctors. So the Blue Shield originated from Tacoma, Washington, and they started collecting premiums for the doctor's bills. So that's how Blue Cross and Blue Shield came about. Ultimately, they merged and it became Blue Cross and Blue Shield. This went on during the Second World War. Again, they continued to have this expansion of these coverages through insurance, through the not only through the depression, through the Second World War. And in 1960s, what we faced with people who are retired, they could not afford to uh, on because they didn't have any income, other sources of income. President Lyndon Johnson came with the idea of having Medicare for seniors. That's how the Medicare started in 1965, 64, 65. So they were able to receive the Social Security Act in 1965. Folks, I'm just giving you brief outlay, but I'll be keep updating how these things originate. But there's a saying: when you pass a legislation to the Congress, it crowds out to the future. What does it mean? It crowds out to the future. That legislation stays as it is without modifying it. Even to this day, the Medicaid, which started in 1960s, it is still the same. It has not changed, it has not updated. So it's like, if you had a car, Lincoln, in 1960s, then here you're in 2020. It's an antiquated Lincoln model, which for 2020 it has not been updated as we move along. That's how it says crowds out of the future, means it could not keep up to date. The legislation keep not up to date with what things have transpired. Technology came in. Now we have telemedicine, telehealth, AI, robotics, and blockchains. So Medicare has not been changed since 1960s, folks. This is what I'm trying to say. Medicare has not changed. So I will briefly explain. Now I told you how the Blue Cross and Blue Shield, then Blue Cross and Blue Shield was one company. Blue Cross paid the hospital bills and Blue Shield paid the doctor's bills. So when Medicare took off, so what happened is Medicare Part A is the hospital costs, which at that time in 1960, Blue Cross was a major insurance carrier. So Blue Cross managed the Part A portion of it. Basically, they handed the management to a Blue Cross in 1960s. Then, as far as the doctors' bills, they shifted. As usual, the Blue Shield was handling Part B. That became Part B. That's how Part A and Part B Medicare has been till this day. We still have Part A handles the hospital bills. Part B handles the physician's bills. All right. I'm trying to simplify it, folks. This is, uh, I've listened to and read through some of these aspects regarding this Medicare legislation. So Medicare, over the period of time, instead of keeping up to date with the hospital costs and Part A and physician's costs Part B, the legislation stayed as it is. Right now, as we speak, If you are in Medicare, you have if you're hospitalized, that portion the portion you have to every time you have a hospitalized, you have to pay a copay. This is all without any additional insurance. So you have to pay up to 1,400 and odd dollars. Every time you get hospitalized in a year, you have to pay the first 1,400 by you. And this is up to when you're hospitalized for up to 60 days, then you don't pay anything. So Medicare part covers the rest of it. But after 60 days, there is the additional payment of $370 per day for for till 90-day period. Till 90-day period. So what happens is in a yearly, if you go beyond that, if you go beyond 90 days, the Medicare will cover, but after 120 days, you're liable for $750. So this is where the difficulty comes for the Americans to come up with this kind of a payment structure for a lot of senior folks. And even if for the employer subsidized, it is managed by the employer. Whereas people on Medicare, they are totally dependent on Medicare for the healthcare bills. Then late 1980s, since this what they have done to the Medicare, instead of modifying Part A and B, they come up with a Medicare Advantage, late 1990s, folks. Medicare Advantage. Medicare Advantage is basically is alternative to the government Medicare. Medicare Advantage is not original Medicare. It is given to a private company, so they provide the care because private companies are a little more efficient in providing the care. That's how Part C started, so-called Medicare Advantage. In the Medicare Advantage, the private companies takes the funds from the Medicare and they include all the, you don't have to come up with deductible portion, $1,400, and you don't need to come up with after 60 days, $370, and you don't need to come up with $750 after 120-day period. So Medicare Advantage collects the premiums from the Medicare and provide the care to the senior folks. That's how Part C came about. This is an interesting history, folks. You really need to look into that. So the Medicare Advantage, so-called Medicare Advantage, is not exactly Medicare. It is an alternative to Medicare. You guys need to understand, once you get a Medicare Advantage, you're basically giving up on your Medicare. And it is going to be handled by a private insurance carrier like Blue Cross Blue Shield, Aetna, United Healthcare. All these companies, they handle the Medicare Advantage part. So private companies take over. Then issue came about the drugs. There was in 2000, early 2000, there was a big debate about drug costs because drug costs kept going higher and higher and the senior folks could not afford. And at the same time, they were saying to set up personal care accounts for the seniors. So Republicans came up with the idea of setting up personal care accounts to pay for the drugs. So that's how the health savings in year 2000 Four, health savings was originated by a, a conservative so-called um, Republicans, whereas the they wanted a government to pay for the drug costs. That's how Part D came about. Under the George Bush administration, with which he was going to be, again, he was running for the presidency for the second term, but just prior to the election, they came to a compromise where they were able to introduce Part D in early 2004, just prior to the election. So Medicare recipients had to pay a small portion to cover the drug costs. At the same time, they passed health savings. So they came to a compromise. That's how the Medicare Part D came about. That's how the health savings came about. So, health savings, most of the insurance companies resisted that idea, having personal care accounts. So, the health savings started in at the same time as Part D, folks. Health savings concept was so people, when they're young and they're doing well and they don't have any healthcare problems, they can put money aside by obtaining a deductible policy and lowering your premium. This is for the employers, folks. When employers were spending for the health insurance, it worked in favor of the employers and the employees too. So employers basically, instead of paying, because most of the major employers are self-insured. So what they did is they came with an idea of deductible policies so you can lower your premiums, and whenever the premiums were lowered, the money saved is put aside into so-called health reimbursement accounts or health savings accounts. So employers had an option either to put it in the health reimbursement, which is controlled by the employer, health savings, which is controlled by the employee. That's how the HRAs and HSAs came about. But health savings account really took off because that gives the power of control back to the consumer, folks. It gives back to the consumers. Health savings accounts brings the consumers to the front line because they make the decisions which insurance to buy, how much to pay the premium, and also they get to demand the affordable, like they demand affordable healthcare costs, demand more transparency, and demand quality. So that's how this health savings has really blossomed into over like a $200 billion industry. It's over 200 to $300 billion industry right now. So it is benefiting to the majority of the folks who are employed by these major companies. So Medicare, even though as we sit here today, Medicare has, this is what I was saying, Medicare as we see it today is so antiquated. We are still under the 1960 legislation passed by the President Lyndon Johnson. We are still, it's so antiquated, folks. It's like saying, you want to buy an old Lincoln car, or you want to buy a brand new. See, it has not been updated to bring it to par in the today's atmosphere. What I see here, we have a unique opportunity to modify the Medicare, where Medicare recipient can have also a personal care account on the side. so they can put money aside so they can buy a deductible healthcare premium. And at the same time, see, the Medicare Advantage, so-called Medicare Advantage, should be, they should also have a provision where a recipient, Medicare recipient, can decide themselves if they want to get a deductible policy themselves and put money aside into the health savings. So this Medicare Advantage need to be in, it should be in the consumer's favor. Right now it is not. It is not consumer driven. The Medicare Advantage is, they're giving it to the big companies, but I'm pretty sure the Medicare recipients, the Social Security, what the Medicare recipients are getting is not adequate, folks. It's not adequate. What I'm trying to say is if you involve a Medicare into Part C, like a Medicare Advantage, instead of giving it to a private company, can you have a Medicare recipient decide and lower the healthcare premium? Because if a person is healthy, he should be able to shelter the money into personal care accounts himself. He doesn't need anybody to tell what to do. So ideally, the Part C should be modified towards the Medicare recipient. If it can be modified, so Medicare will be transformed into a personalized healthcare. That's what I'm trying to get at. We should make the Medicare into a personalized healthcare rather than middlemen, so-called Medicare Advantage is handled by big insurance company lobbyists. And if people want to take care of themselves, you should give the option to the Medicare recipient. If they want to save some money in their healthcare, they should have an option to buy a deductible healthcare premium policy themselves under the so-called whatever, the Blue Cross, Blue Shield, United Healthcare, Aetna, you name it. They can buy a deductible policy, lower the premium. They should be able to put money aside into their health savings accounts, so-called personal care accounts. This is where I've been talking about personalized healthcare, folks. Personalized healthcare gives the consumers the advantage and flexibility towards their own health. So they can choose their doctor, they can choose their hospital, they can choose the pharmaceutical, they can choose their drugs. I hope I'm being very clear about it. Now, with the technology, this telemedicine, telehealth, and ledger, blockchain ledger system, so called ledger system, Medicare pays these hospitals under the DRG groups. That's another thing we need to talk about, how the Medicare pays the hospitals. That's another big discussion itself because DRG, diagnostic related groups, the way originally in 1960s, the way they were doing it is they grouped under the diagnostic related DRG groups. They were being reimbursed based on the DRGs. If the hospitals managed efficiently in lowering the cost, they were able to receive more funds from Medicaid. That's how they were incentivized. So they need to control the cost. But in that process, there were so many people, their costs went up, and if they're outliers from that program, the Medicare was getting more money if they're outliers. So even Medicare billing system, so-called, they bill this Medicare. They're all made up number, folks. They're all made up numbers. I'm not even sure how those numbers came about, but they need to be looked into. I would rather have the consumers decide, let them decide how much they would like to. This is what it is. Once the consumer is in the driver's seat with the personalized healthcare, the prices are transparent. So-called consumer demand will dictate the payment, folks. Consumer demand. Yes, consumer. So-called demand controlled healthcare. Any other industry, we have seen when the consumer demand is high, the costs are high. When the consumer demand is low, the costs are low. It automatically takes care of itself without without anybody, without any intermediary organizations. These billing systems have to go, folks. These surprise medical bills, the diagnostic related billing system, they need to go, man. They really need to be transformed into a different payment structure, folks. Right now, what I see, hospitals being reimbursed on the DRGs, they're not real numbers. They need to be more transparent. From this year, they're supposed to be transparent. So we will see how that works out because hospitals are supposed to disclose the prices. Once the consumer knows how much to pay, I think consumer demand will dictate the prices for consumers' demand. Transparency will bring in consumers' demand, and that will change the healthcare costs. The same thing, consumers demand on healthcare premiums, healthcare insurance premiums. If your Medicare, if a Part C, if they let individual seniors decide that they will get their own personal health insurance under the private umbrella, let the seniors decide rather than Medicare giving the control to the insurance companies. I would rather give that control to the individual seniors, so-called AARP members. They let them decide which insurance they should buy and let them pay for the insurance. So if they buy a deductible policy, they can put money aside into the personal care accounts. Personal care accounts. That will lower the cost, folks. I bet you. Once the consumers are in any other sector, in any sector, you look at the retail, you can look at the groceries, look at the restaurants, you name it, consumers demand will lower the costs. That is a fact. Whenever there's a consumer demand, there's more competition. When there is a consumer demand, there's more right now healthcare is going in the wrong direction, folks. This consolidation of these health insurance companies, consolidation of the hospitals, consolidation of the medical groups is not the way to go. When the consumers in the front line, they want more competition. It's totally opposite of what. So this is what the problem I see. We are spending $3.7 trillion every year. This is from numbers from 2017 onwards. $3.7 trillion, which is 17.8% of the GDP, bigger than the national defense budget. You know where we stand on healthcare? Because consumers have had no option. They were never given any choice. Right now, as we sit here today, America ranks 37th among the most advanced countries, folks. 37th, because consumers were ignored all this time. America is at its best when consumers were given an option. America is at its pinnacle. It shines when consumers have a say in healthcare costs. So I would like to see more and more consumer, even if Medicare needs to be, if when we talk about Medicare for all, before we do Medicare for all, let's look into how to set up, how to modify Part C of the Medicare towards in the favor of the consumers, folks. It has to be favorable to the consumer. I'm sure ARP would love to hear Part C instead of having a Medicare Advantage, which is not a Medicare, but it should be modified in favor of the consumers. So consumers should be able to decide where they want to buy the insurance. Give the option to them. Let them choose if they want to buy. Aetna, Blue Cross, Blue Sheet, United Healthcare, because there'll be more competition among the insurance companies, folks. If if suppose I know I'm a Medicare, Medicare, I have a supplemental. I pay United Healthcare my supplemental. They take care of everything what I pay for. But a lot of folks out there can't afford it, can't afford having supplemental. I understand all that. But at the same time, our social security is dwindling. The way to address the social security is give the seniors an option to buy their own health care so they can shop around for a lower premium. People are healthy. Again, coming back to the healthcare itself. So right now, our risks are generalized. They're not, there is no segmentation. Insurance companies hate to do this. Insurance company doesn't want to segment the population. 68% of the folks are healthy. They can receive the funds from Medicare. They can buy the lowest premium possible policy and save the money, put the money into the personal care, so-called health solutions advantage or health care, health savings accounts. They can do that. 68% of the Americans are healthy folks. And you have people at risk category, people who are smokers, drug addicts, hypertension, diabetes. These are at risk category and their premiums are a little bit higher, but we need to focus on this group. If they take if they take proactive, like if they stay proactive and take education class, even obesity, if they take education classes, modify their diets, modify their behavior, modify in taking care of their good, they should be rewarded and they should be able to get a lower policy. What's wrong with that? These are people are at risk category. Right now, the insurance companies are not segmenting it. That's a sad part because your premiums, what you're paying for a is all broad-based risk. That's how the insurance companies actuarials are written. The actuarials are written based on broad category. They're not segmenting into well category, at risk category. And the only 15% of the Americans have chronic illnesses, folks. You mean to say America cannot handle the 15% of the Americans who have chronic illnesses? I don't buy that. I really don't buy that. We really need to focus on those 15% with telemedicine, telehealth, with AI, you name it. We can take care of these folks at a reasonable cost as long as consumers are in the driver's seat, folks, through a personalized healthcare. Personalized healthcare is the way to go, man. That's the way to go. Even for youngsters, older folks, you name it. Personalized healthcare is the best option we have. And so-called health insurance personalized. So you can buy what you need. You can buy the insurance premium what you can afford. So you can save money and put it aside. If people have enough thing, they might get a higher deductible policy and lower the premiums and put aside the difference into the personal care accounts, which goes a long way, folks, by having even Medicare folks should have access to contributing to the personal care accounts, so-called HSA accounts. They should. Right now, Medicare recipients cannot put money aside into the health savings. I don't see why not. I don't know why we're procrastinating it. Medicare folks should have HSA accounts. They should be able to put money aside as long as Medicare lets Part C is handled by the consumers. I would like to see Part C. You cannot ignore the American consumer, folks. They have been neglected for too long, too long. And I would like to see consumers decide on which insurance to buy, which insurance to how much deductible they can participate, they can have. If people can afford, they want to have $3,000, $5,000 deductible policy, lower the premium. Medicare, this is for Medicare, folks. I'm not talking about the employers subsidized. I'm talking about if this were Medicare, they should be able to put money aside into the personal care health savings accounts, and they should have a coverage for major medical policies and pre-existing illnesses. It's automatically covered, folks, as long as you have certain reforms. Health insurance, that's what we need to do. Health insurance reform. What the best thing Obamacare has done is focus on the pre-existing illnesses. We need to have a coverage for all pre-existing. This is where chronic illness category, folks. People who are in the chronic illness, these are the folks. They need an insurance policy based on chronic illness. Their premiums are based on the chronic illness, and even these folks should be able to get a deductible policy, lower the premium, and they could be incentivized and rewarded for the good behavior. If I have a hypertension, if I take care of all these, stay proactive and lower my blood pressure, monitor my blood pressure, keep my blood pressure under control, you should be rewarded. You should be rewarded. I don't see why can't. And if you're patient with the diabetes, you have right now with the technology what we have, you can document everything right in your mobile. You can prove that you're being proactive, taking care of yourself, your health, incentivize them, give them the control back to the consumers, man. Consumers can, with all the technology we should be able to be, actually our focus should be on chronic illness category, folks. Chronic illness category is the main focus. And people with catastrophic, let the consumers decide how long they want to have a catastrophic policy. How long do they need? Let the consumers decide. They can buy a catastrophic coverage whenever they need it and at any time they need it and what length of period they want. Let the consumers decide. Folks, this is the best option we got. And the Medicare, as I said, any legislation we pass, it crowds out to the future because legislation what we have is from 1960s, folks. 1960s. It has not been modified. Medicare has not been modified. We keep coming with Part A, B, C, D, but original Medicare for the hospital payments, physician payments, it has not been transformed. It has not been modified. It has not been transparent. That's what I would like to see. We need to bring that original Medicare legislation and do some finer adjustments in the health insurance reform, so-called Medicare reform. We need to adjust it accordingly, because this is after 50 years. We should be able to modify the original legislation. We need to modify the legislation which is good for all Americans, folks. All Americans. Well, I keep talking about this personalized healthcare. That's my goal. I'll continue to talk about it till the day I die. Yes, till the day I die. This is Consumer's Doctor on behalf of Foremost Organization. I hope I'm giving you some ideas, folks, for the general public. So this Medicare, so-called Medicare reform, it is high time we reform the Medicare. We reform the Medicare, yes, because we need to upgrade the Medicare to the present day, not to stick to the original Lincoln. We need to broaden it and make it bigger and make it more amenable and consumer friendly. Thank you, guys. I love you. I'll continue to, whatever I get inspired, I'll continue to give my message to you guys. So we will see you in the next episode of Personalized Healthcare. Bye.